Today, we are discussing gestational diabetes and how it affects your baby. What you need to know about fetal care. Yes, we are still on the same topic, getting it done very well. Hi, beautiful mamas. Welcome back to Kashi's Corner. In this channel, we discuss real life experiences and growth movements. Yeah, you may have been told you have gestational diabetes and you might be wondering, how does it affect my baby? Is my little one okay? What should I be doing differently? Chillax and relax, because today we are walking you through everything you need to know about fetal care when you have gestational diabetes, including the risk, monitoring, and how you can help your baby thrive before birth. This is how gestational diabetes affects the baby. First, let's understand what's happening when you have GDM. Your blood sugar levels can run high. That extra sugar crosses the placenta and goes straight to your baby. And in response, your baby's pancreas works over time to produce insulin, and this can lead to a few things like low blood sugar at birth, increased risk of jaundice, higher chance of NICU. But don't panic. All of this is manageable with the right care and monitoring. And this brings us to monitoring the baby's health. So if you are diagnosed with GDM, your healthcare provider will keep a closer eye on your baby, especially in the third trimester. They will monitor your baby in these ways: ultrasound monitoring. You will likely have extra ultrasounds to check for fetal growth, amniotic fluid levels, and organ development. This helps detect macrosomia, which just means your baby is growing bigger than average. Non-stress test, NST. In later weeks, usually around 32 to 36 weeks, you may have non-stress tests where we monitor baby's heart rate and movements. It is safe, painless, and gives real-time feedback on how your baby is doing. Yeah, do you know your management protects your baby? Here is the empowering part. What you do daily has a direct impact on your baby's well-being. Here is the checklist: healthy meals, blood sugar monitoring, physical activity, taking meds if prescribed. All this helps. Keeping your blood sugar in target range reduces the risk of complications dramatically. That means a lower chance of excessive weight, better lung development, and fewer issues at delivery. You are not just growing a baby, you are growing strength. Now, planning for delivery. Your birth plan may change slightly depending on how your GDM is controlled and how your baby is growing. Induction may be discussed around 39 to 40 weeks. C-section may be considered for large babies. NICU team may be on standby, just in case. Most moms with well-controlled GDM deliver healthy babies with no complications. The key is preparation and ongoing communication with your care team. After birth, your baby will be monitored closely for a few things, especially blood sugar levels in the first 24 hours. Your baby will be checked after birth for blood sugar tests, jaundice screening, possible NICU observation. If all goes well, and it usually does, you will be cuddling your little one and feeding them just like any other mama. Remember, breastfeeding helps regulate both mom and baby's blood sugar. But yeah, gestational diabetes might change your pregnancy, but it doesn't have to change your joy. With good care, smart choices, and the right support, you can protect your baby and yourself. So what happens after delivery? What happens after the baby is born. In most cases, blood sugar levels return to normal within a few days after delivery. However, this doesn't mean you are completely out of the woods. Here is what you can expect after childbirth. 1. You are to check your blood sugar within 6 to 12 weeks after delivery. Your doctor will recommend a glucose tolerance test or fasting glucose test to check if your blood sugar level are back to normal. If your results are normal, you will still need screening every 1 to 3 years because up to 50% of women with GDM may develop type 2 diabetes within 5 to 10 years. If your blood sugar remains high after childbirth, you may have persistent diabetes or pre-diabetes, which requires ongoing care. Your lifestyle changes after childbirth. Even if your blood sugar is normal now, postpartum is the perfect time to adopt some healthy lifestyle habits, such as healthy eating, follow a balanced diet high in fiber, whole grains, vegetables, and lean protein. Limit processed sugars and refined carbs. 2. Stay active. Even a 30 minutes walk daily can help lower the risk of diabetes. Involve your baby in your fitness routine. Now you need to manage your weight well. Try to return to a healthy pre-pregnancy weight gradually. Losing just 5 to 7% of your body weight can significantly reduce your risk of diabetes. Breastfeeding. Breastfeeding does not only benefit your baby, but also helps regulate your glucose metabolism and aids in postpartum weight loss. Let's not forget the emotional side of postpartum care. Dealing with GDM, adjusting to new motherhood, and worrying about long-term health can be overwhelming. If you are feeling stressed, anxious, or down, talk to someone, your partner, a friend, or your healthcare provider. Postpartum depression is real and support is available. Very importantly, don't skip your postpartum follow-up visits. They are essential. Your doctor will reassess your glucose level, discuss your long-term risk, help you create a diabetes prevention plan. And if you are planning more children, early screening for GDM in your next pregnancy is crucial, especially if you had it before. Remember, gestational diabetes doesn't define you. It's just a sign to take better care of yourself. Starting now with the right lifestyle and regular checkups, you can reduce your risk of future diabetes and stay healthy for yourself and your family. Get tested regularly. 6 to 12 weeks postpartum glucose test every 1 to 3 years after that. Eat smart. High fiber, low glycemic food. Stay active. 30 minutes most days, even walking with your baby counts. Breastfeed if you can. It helps regulate both mom and baby's blood sugar. Know your family history. Genetics matter. If diabetes run in your family, you may need to be even more proactive. Having had gestational diabetes doesn't mean you are doomed. It simply means you have a head start, a chance to take charge of your health early. If you found this video helpful, don't forget to like, comment, and share, and subscribe. Thanks for watching and take care. Bye.